What you want, when you want it, where you want it. This is The Mesh.
Hey everybody, this is Dr. Matt, and this is Take Back Your Health podcast, where we talk about all things health and ways to help you be the best version of you. Hey everybody, this is Dr. Matt. This is Take Back Your Health podcast, and I'm here with a special guest friend of mine, Dr. Ann Gonzalez with Emerald Health Primary Care and Aesthetics. Welcome, Dr. Ann.
Thank you. Thank you for having me.
So tell us real quick a little bit about Emerald Health for people that are new and don't really know what Emerald Health is.
Sure, absolutely. So Emerald Health Direct Primary Care and Aesthetics, it is myself and a partner, Dr. Rachel Kelly. We opened in 2021 after some good times in 2020 and ongoing. So, but it is it's called Direct Primary Care, which is a different kind of healthcare model where we don't bill insurance. It is a monthly membership fee. So you don't have to deal with all the nonsense of insurance. And besides, nowadays, what does insurance get you?
Exactly. So I don't deal with it.
Yeah.
But so it's different from typically what most people are used to with urgent cares, emergency rooms, doctor visits. So kind of what sets it apart, I should say, from that?
Well, there's a lot of differences, obviously. Number one being we don't take insurance. And a lot of times people, when I explain direct primary care, they say, oh, you're concierge. And there are some similarities. Absolutely. We have smaller patient panels just like concierge. And of course, we don't take insurance. But a lot of concierge practices actually do bill insurance as well. So you have a yearly retainer, which can run $2,000 to $3,000 a year. And then you still pay your copays when you go in for your visits. So it's kind of, I call it double dipping. But our practice is different in that we only bill that monthly membership fee. So whatever we do within the office is covered under that fee. So if you have to come in 2 or 3 times a month because, you're sick and we need to recheck you, you don't pay any copays. You don't pay extra for that. That's all included. And we also do telehealth. So in the previous system that we worked in, if you had a rash or something, you definitely had to come in. If you had UTI symptoms and you've had 100 UTIs in your life and you're like, this is a UTI, you still had to come in because you can't bill over the phone. You can't bill for a phone conversation. Correct. And that's all included. So if one of my patients is like, yep, it's a UTI again, then, they just call, they message on the portal. Some of our patients will text us and we'll say, okay, sending your medicines to the pharmacy. And that way they avoid having to come in for something that's pretty routine for them because they know what it is. And they save time going to the doctor's office, sitting in the waiting room,
So it's like having a doctor in your pocket.
Yeah,
basically.
Yeah.
I mean, that's the benefit I'm seeing from that. Because health insurance. We're talking about health insurance. Health insurance is so crazy expensive anyway. Now it gets worse every year. So doing something like going with Emerald Health, the direct primary care, that's sometimes a better option for people that have high premiums. Absolutely. Now, obviously, yes, you do need some insurance coverage for the drastic things like heart attack, stroke, cancer, things like that. I understand that. But for people like myself who go to the doctor once a year for a physical, it doesn't make sense to pay over $400 a month and not use it.
Right.
So I could see why that would dramatically affect people's wallets and just everything, to have somebody that you can call like on the weekend.
Yes.
You wake up with, COVID or something on a Saturday morning, say, hey, like, I think I have COVID, and you do a little telehealth visit. And it's like, you don't even have to leave your house. That's amazing.
Yeah. So it is, it is really beneficial in the sense that if you, for example, you go to the doctor once a year, but maybe through the year, there are these little things that pop up that you're like, oh, I should call about that. And you never get around to it. And then you go to your annual and you have a list of all kinds of things, which, yes, you should be able to talk to your doctor about it. But when you go for your annual, that's your annual. Like they have all kinds of things that they want to talk to you about. Like, did you do your screening labs? If you're due for colonoscopy, did you get, all these screening things that you also need done. And there's no time to talk about other issues. So then you have to come back for that.
Well, the bad thing is it becomes like it's a routine to where they're not really there to learn you. They're just more of a take a number style deli where, you're just a number on a chart and you're just, they're doing the basics, let's get your lab work, let's get your A1C, let's get all this kind of stuff. and you don't really get the doctor that knows you.
Yeah. And to be fair, the system, it's the system. The
of
system
course,
is the
it's
problem,
completely the
right?
system. Yeah.
And, I know a lot of doctors who are still in, we call it the system, that, it's so hard.
Yeah.
They want to do more, but they can't because they have to see 25 or 30 patients a day, and there is no time.
Nope, there's not.
Yeah.
Now, how many, what would it say, as far as how many patients do you typically see on a daily basis or weekly basis? Because I know with the typical primary care, they're just urgent cares are seeing, you got 17 people in the waiting room.
Yeah. It really depends. Every day is different. So like today, so far I've had one patient that I saw in the office, but I've, messaged with 3 or 4 already and deal, I review their labs. So it's, I have a lot of patient contacts, but not actually patients in the office.
Exactly, which makes you even more accessible. So if I or somebody wanted to come see you guys, you're not going to wait 30 minutes to an hour to get seen, which I have done many times waiting on a physical to get seen by the doctor for 3 minutes, and then you're out the door.
Yeah, we have a quote-unquote waiting room. It's not really a waiting room because you really don't wait very long.
It's a sitting room. Right?
Some people walk in, and I'm like, just come on back. Don't even sit down.
That's exactly how I do with my office.
Yeah.
So you talk about the system being broken. Yes, absolutely. So the problem with the take a number style of healthcare, how is what you offer better in the long run than the typical route with urgent care? And obviously, urgent care, emergency rooms, we're not knocking them. They definitely have their necessity. But a lot of people, and you agree, use those as their PCP versus when they should not.
Right. Well, I'll back up just one bit and say we do encourage people to have catastrophic insurance if possible. Absolutely. Because people think direct primary care, are you saying I don't need it? No, absolutely. No. You need some sort of catastrophic coverage, whether it is insurance or something like a health share, which we haven't even talked about yet, but that's a different way of covering your major medical expenses. But primary care, it just doesn't get enough attention in this country. It's obviously underfunded, but primary care is where you get your preventive care, your doctor, and that doctor knows you. So
exactly.
I have patients where if I hear from them, I'm like, ooh, that's a problem because I know them. I know they don't come very frequently. Or, they say, oh, I've had this thing on my foot for a while and I know they're diabetic and like, you need to come in and get checked. So there is a lot of benefit, obviously, with knowing your doctor really well. Plus, patients are more comfortable with sharing with you if they know you well.
Exactly.
And even things like home visits or even telehealth visits, you can tell so much about a patient just by even just telehealth visit, being able to see the situation that they're in at home, their living environment. Is it crowded? Is it dirty? Or do they have access to certain things? And that makes a big difference. These are things that you just don't see when someone comes into your office. Oh,
yeah. People have to be comfortable in order to be open up, and they're not going to tell you things that they're dealing with, problems they're having, because, one, they don't know if it's a problem to begin with, and sometimes they're afraid to talk about it because they don't know what you're going to say. Right. But yeah, that's the benefit of having a doctor that knows you versus just knows your name.
Right.
Because I'm not knocking my doctor when I go see her for a physical once a year. I see her once a year. So it's very shallow. It's very superficial.
Sure.
But when my patients come to see me, when your patients come to see you, they feel more comfortable because they see you regularly, or they know you, so they know that you care about them.
Right.
So that is why I think there's so much benefit behind this kind of healthcare.
And we have time to talk, and we talk about other things. Like I talked today with a patient whose daughter is in 4th grade and starting to have to wear deodorant, and we start talking about things like that things that happen, and we get to talk about family and hobbies and things that they're doing.
Of course.
And
you get to know the person.
Yeah.
And that's what makes it fun. That's what makes the job fun too.
Yeah. It's a great way
because you don't
to
feel like you're
practice.
going to the doctor, because a lot of people do not like going to the doctor. I myself do not like going to the doctor, quote unquote, because you're just afraid of what they're going to find, or you're afraid of what they're going to say, and you don't want to hear bad news. Yeah, your blood pressure's too high, your diabetes is getting a little bit out of control, and you're just like, I know. I mean, I'm sure you tell patients that all the time.
Yeah. And our office is in an old house, so it doesn't feel clinical.
Exactly.
That's what we wanted.
Yeah, and that's how I do with mine. Now, as far as not knocking the urgent care and the emergency rooms, obviously they do have their place. I mean, if somebody has appendicitis, or somebody's got a staph infection or MRSA or sepsis or something, yes, I need you to go to the urgent care. But you don't need to go to the urgent care if you're having like constipation or something like that. That's minor, I should say. It depends. I mean, every situation is different. But I'm talking about the people that go to the urgent care for the smallest little things.
Sure. Yeah.
And a lot of that comes down to, I want to say, I guess, affordability too. Some people can't afford to go to their primary care very often, so they go to urgent care. But then the urgent care visit is just as
really
expensive.
Affordable.
I know it's not. I don't know. Maybe I don't know what I'm saying. I guess it depends on the insurance you have. And that's another thing about how I'm glad that we do not take insurance, because it's so restrictive, because you're going to go to where they are going to pay, not necessarily where you need to be, if that makes sense, to get the best kind of care.
Yeah.
And that's something I try to explain to my patients. Like, I don't take insurance not because I don't want to, but because it's they don't care about you. That they care about your copay, and I want you to get the coverage and the care that you need, not what they're going to allow is the key word, I should say.
Yeah, and we still, I mean, even though we don't bill insurance, we still have to deal with it in the sense that whatever outside of our office, if you have insurance, is covered by your insurance. So lab work, medications, obviously hospital, emergency type things. But we also do, we offer very low cost lab work that is out of pocket. So we can see anyone if you have insurance, if you don't have insurance. And even if you have insurance, if you have a very high deductible, like a $5,000, $10,000 deductible, if you go and get your labs, and these are, say, labs that maybe not covered by your insurance, and it costs $250, well, that's all going under your deductible. Like, you still have to pay that. So a lot of times we'll have people just what we call client bill their labs, because we can do it for, say, $25 as opposed to $250.
No, and it really also, going back to the personalized service, that's what you get when you get what you're doing, because you get that personalized care. It's not rushed. You're not a number. And you have a doctor that knows. You don't have to memorize the chart every time they come in. Like, you see me, and you're like, oh, how's your so-and-so doing? Or how is this working for you?
Yeah.
That is the big benefit of doing something like that. Now, going back to what you had said about the insurance, so I know you take labs. Because you weren't doing labs eventually. Are you doing labs now? Or are you working toward that?
We do labs at LabCorp. And
gotcha.
also at a Woman's View. Yeah. So we aren't drawing them in the office. We would like to.
But you're going to in the future? Yeah. I think that's what you had told me. Now, as far as services go, and we'll get into the aesthetics here in a second too, because I do want to touch on that. But as far as you provide the direct primary care, what are kind of like your services that you provide, I guess?
Yeah. So obviously, primary care services. So chronic care management, acute care. So cold, sinus infections, urine infections, respiratory infections, those kinds of things. We do, sometimes I'll have some laceration repairs. It just kind of depends on what it is. We don't do like broken bones in the office. Those are like urgent care or ortho, quick care kind of things. We will take off skin tags, moles. We'll send them for pathology. We do well women care. We do pap smears. We do a lot of hormone therapy, hormone replacement therapy. We do weight management. We also do cardiometabolic risk evaluations. So for people whose family members maybe were 45 and had a heart attack, and they're wondering, what's my risk for having that happen? We will do advanced lipid panels. These are one of those things that maybe your insurance won't cover, but we can do it for cash. And then some people need coronary artery scans, and so we can get those at a local radiology center.
Now, real quick here, I know jump into the aesthetic side because you also provide the aesthetics. When did that come about, and how do you implement that as part of the practice?
Yep. So we were open probably about 9 months when we started offering aesthetic services. So we started with injectables like Botox, some fillers, and then we've slowly added some energy devices like Neogen and lasers. We also have an esthetician now, which is wonderful, which is amazing.
Yep.
But yeah, it fits in really well. At first, when I first started after my residency, I thought, aesthetic medicine, that's just vanity. Now that I'm older and wiser,
it has its purpose. Yes.
Yeah. No, I mean, and it fits really well with primary care because it's obvious. If you feel like you look better, right? You feel better.
Of course.
If you're pleased with how you look, and actually, it does help with mood, obviously. And actually, Botox has some studies that it actually helps with depression.
Oh, no, I'm not saying anything wrong with aesthetics. Aesthetics is definitely a fantastic field. I just don't like to see when patients use that route when they're not doing what they need. It's almost like covering up symptoms. Like we're not using that. I'm glad that makes you feel better and look better, but you also need to take care of your inside, yourself, because you can't just put something on and pretend that it's not going to be there.
And that's something we talk about too. It's like skincare, what are you eating? Are you drinking your water? Are you sleeping? Those things affect your skin too.
And that's what comes back to the personalized service. Because, when you go to the typical doctor, they just ask you a few questions, listen to your heart, listen to your lungs, take your vitals, and you're out of there. But when I come to see somebody like you guys, you actually get a more detailed evaluation. And you actually learn more, because you'd be surprised at how many people. I mean, we're both doctors and we study the body pretty intensively, but you'd be surprised at the lack of knowledge when it comes to the body in the general population.
Yeah. And we are really, we are big proponents for lifestyle medicine, which of course is, there's the 6 pillars of lifestyle medicine. So sleep, exercise, diet, stress management, avoid risky substances. So those are
avoid exactly.
Those are all parts of it. So we talk about all of those things.
Oh yeah. Well, as far as if a patient wants to book with you guys, what would be the best way to do it?
They can call the office, or
are
go
you
on
accepting
our website.
new clients?
We are taking new patients. We have just hired a nurse practitioner, Karen Gimlet. She's been practicing for 20-something years, and we used to work with her at a previous practice, and so we know her very, very well. Great nurse practitioner. So she's taking new patients. We are taking patients for perimenopause consults and also cardiometabolic consults. So yeah, we will take new patients, and like I said, insurance or no, we can still see you.
And so you don't have to have insurance to get
an
appointment with you. Just pick up the phone call. So what's their social media? How do they get in contact with you?
On Instagram and Facebook, it's Emerald Health DPC. And we also have a YouTube channel. I think it's Emerald Health DPC and Aesthetics. You can just Google it. It's fine.
And you have another podcast too, do you not? Or
yes.
I'm about to say, you want to give that a little shout out to?
Yeah. I do. I do have a podcast. It's called DPC Life, and that is more geared towards direct primary care physicians or people who are trying to get into direct primary care.
Gotcha. Well, like I say, healthcare works best when the doctor isn't just treating the symptoms, they're caring for the person. And that is why I think it's different with going to somebody like you. Well, I appreciate you coming out, Dr. Ann.
Absolutely. My pleasure. Thank you for having me.
Absolutely. If you'd like to learn more about what you just heard, or if you're interested in scheduling an appointment to see how chiropractic can help you, visit our website at newdirectionschiropractic-nc.com. Be sure to follow our social media page for more information on how to be a better you.
You've been listening to The Mesh, an online media network of shows and programs ranging from business to arts, sports to entertainment, music to community. All programs are available on the website as well as through iTunes and YouTube. Check us out online at themesh.tv. Discover other network shows and give us feedback on what you just heard.